Hello, my name is Edith Jones. I am the Senior Administrative Coordinator for the Department of Health Policy and Management.
How do you support the mission of HPM?
So in my role, I support Dr. Daryl Gaskin and his Center for Health Disparity Solutions.
What motivates you to come to work?
I really enjoy my work. I enjoy my coworkers. And it's a rewarding feeling to be able to work with healthcare and policies and see things into action.
What are you passionate about?
I'm actually passionate about seniors and their healthcare and and wanting to help them move through the healthcare system.
What impact do you hope to have?
Well, I hope that when I retire from this job, I'll move into the field of working with seniors in the healthcare field because I see a need. There's a lot of paperwork that has to be filled out, and most often they don't have people to help them.
Can you give an overview of what your career path has kind of looked like?
So I came to the hospital in '79. I worked till '82. I was working actually in neurology, neuro-oncology, and something key. I worked for Dr. Carson, Benjamin Carson, for a few years. I was doing his transcriptions for OR procedures, and then I was working for another doctor in that office in neurology who worked with Tourette's patients. I left for another 10 years and started working for Chesapeake Health Plan along with a plastic surgeon. And then when Chesapeake Health Plan merged with United Healthcare, I ended up coming back to Hopkins. So that's how I got here back to Hopkins in '97 and ended up working for research.
Did you work for any specific centers when you first joined the department?
So I came in working under the Center for Injury Research and Policy and also working with the Gun Center, which has changed a lot. So I was working with both groups and working closely with Dr. Susan Baker as well because she was the center director. So I've been there for a while. This is where I came and this is where I stayed. So I've been with Health Policy and Management since '97. And now I'm working for the department helping to manage faculty searches for new hires and for the Disparity Center.
When you're not working, what do you like to do to decompress?
I like to write poetry. I like line dancing and I like hand dancing.
What is hand dancing?
Partner dancing. Here in Baltimore, they call it Baltimore hand dancing because it's old. It's what you used to do when you went to house parties and things like that.
So you said you like to write poetry as well. How long have you been writing poetry for?
Maybe 20 years. Yes, I have a book and I keep putting new poems in. When something comes up on my mind, I just throw another poem in.
Love that. I also write poetry. What was it like to be the first staff co-chair of the IDARE committee?
So being the first staff co-chair was a unique experience. It was really great to be able to give a voice to staff because a lot of times staff do not have a voice. I think they felt very comfortable talking to another staff member, so it gave an opportunity to share perspectives that were different.
What has it been like to work for the Center for Health Disparity Solutions?
So working with Dr. Daryl Gaskin, I've gotten to see the challenges that come with disparities. There have been a lot of different groups that we've worked with to talk about challenges in maternal and child health and racism with women in childbirth.
What did you think of HPM's trip to the Reginald F. Lewis Museum?
We had an opportunity to go to the Reginald Lewis Museum under the IDARE committee, and it was really, really an eye-opening experience. The information that we were able to take in was wonderful. We also learned so much about what Baltimore has gone through and the history of Baltimore, where we are housed. So it was a nice opportunity to see that.
I remember you mentioning that you have a connection to Reginald F. Lewis. What's the connection?
Many years ago, I worked with Reginald Lewis's brother, Gene Fugit, at a law firm and working in that law firm was a great experience because I got to see many people in the family through pictures. And also, Gene talked about his brother a lot and how proud he was of him.
What advice would you give to your younger self?
I would tell my younger self to give myself grace and know that whatever I put my mind to, I could accomplish. And that there are many opportunities even when you get older, because sometimes as a younger person, you think that's all it is, or you're going to get too old and you're going to be an old person and you're not going to be able to relate. So I would just give myself a lot of grace and a lot of opportunities.
What should current or prospective students know about HPM?
So if a student is watching this video, what I would tell them about HPM is that it's a place where you can really flourish. There's a lot of experience here. Everybody is willing to give you a helping hand and to try to lead you in a direction that's going to benefit you. And feel free to not only talk to faculty, but you should talk to staff as well, because they hold a lot of experience and be willing to assist.